So next speaker is Dr. Robert Elford John Ryder. He's from City Hospital, Birmingham, from the UK, and he's going to tell us about endoscopic duodenal jejunal bypass linear treatment for type 2 diabetes and obesity, comparing 6 versus 12-month implementation in a worldwide.
Thank you very much. These are my disclosures, and this is the duodenal bypass line. I'm holding one up here for you to have a look at. It's a 60 centimeter impermeable sleeve. It's also known as EndoBarrier or reset, and as over the years it's been mostly called EndoBarrier, I'm going to refer to it as EndoBarrier in this presentation. And it's implanted during a simple endoscopy procedure into the first part of the small intestine, such that the food passes through it rather than the small intestine, and it mimics the bypass bit of the Roux-en-Y bariatric procedure. It's been shown to reduce weight and improve glycemic control in people living with diabetes and obesity. In view of uncertainty about risks versus benefits of EndoBarrier, during 2017 an independent secure online registry was established and the auspices of the Association of British Clinical Diabetologists, ABCD, a collection of safety and efficacy data of EndoBarrier treated patients worldwide. The outcomes from the registry were reported in Diabetes Care in April 2023. However, the subject of I'm talking about today is the fact that many of the serious adverse events associated with EndoBarrier are occurring during the second 6 months of treatment. So it's possible that reducing the period of implantation 6 months may reduce the complication rate. So we aimed to assess the safety and efficacy of 6 months versus 12 months implantation using data in the registry. As of September 2024, data had been entered on 1,101 EndoBarrier treated patients from 36 centres in 11 countries worldwide. And of these, 261 had both 6-month and 12-month data entered. And these are the baseline characteristics of those 261 patients. And I point out in particular the mean BMI of about 40. So these were people living with quite considerable obesity. And this is what happened during the year of EndoBarrier. You can see on the top line that by 12 months they'd lost 12 kilograms, and the hemoglobin A1C mean had improved from 8.7% to 7.3%. You can also see by looking at the numbers 6 months that most of the improvement has occurred by 6 months. As they didn't all have diabetes, we looked at the impact on hemoglobin A1C according to baseline hemoglobin A1C, and you can see that the higher the baseline hemoglobin A1C, the greater the fall, such that if your baseline hemoglobin A1C was greater than 10%, the mean fell from 11.4% to 8%. So the question is, how many serious adverse events would be avoided by reducing the implant time to 6 months? Well, in the full registry, 4.2% of the people experienced a serious adverse event. All the patients with a serious adverse event made a full recovery, and most experienced benefits despite the serious adverse event. However, 43.5% of the serious adverse events would have been avoided by removal at 6 months, and that was 11 liver abscesses, 6 gastrointestinal hemorrhages, 1 cholecystitis, 1 pancreatitis, and 1 abdominal abscess. So that's quite a lot of serious adverse events avoided by removal at 6 months. It was particularly noteworthy that 11 of the 13 liver abscesses, it's 85%, would have been avoided by removal at 6 months. And these are the numbers, and you can see in particular that before 6 months there were 26, and after 6 months 20, and 11 of the 13 liver abscesses occurred after 6 months. So this is the data from today. A year ago, at ATTD 2024, I compared 9 months implantation versus 12 months. And the thing to note here is that you take it out to 6 months, there's still a very statistically significant continuing impact on weight and hemoglobin A1C, whereas, as I showed last year, there's no significant difference between the weight and hemoglobin A1C at 9 months versus 12 months. So it really has all happened by 9 months. So my conclusion is that 9 months wins, and in 2025, EndoBarrier is being relaunched as Reset with a recommended implant time of 6 months. Sorry, 9 months. I just want to show you some of my patients that we treated with EndoBarrier. You can see that this gentleman here was very obese. By 9 months, he'd already had tremendous improvement in glycemic control and weight. This lady here went from obesity to normal BMI. She had evidence of fatty liver, and you can see by 9 months, the evidence of her fatty liver had disappeared. This lady here was on continuous positive airway pressure ventilation for obstructive sleep apnea, and by 9 months, the improvements in weight, etc., meant she no longer needed CPAP. He was very happy about that. This lady here had impaired renal function, and you can see by 9 months, there's not only great improvement in her glycemic control and weight, she no longer has impaired renal function. This lady here went from morbid obesity to a vast amount of insulin to eventually, by 12 months, no insulin required and a normal BMI, but you can see most of the improvement had occurred by 9 months. And this lady here had most of her improvement by 9 months, and had we removed the EndoBarrier there, she would have avoided the liver abscess, which occurred at 11 months, which required intravenous antibiotics and urgent EndoBarrier removal. So this is my summary and conclusion. I won't go through it. I'll leave the slide up, and I think we may have some time for questions if anybody wants to ask any. But I just simply point out the second from last bullet point. Whilst the recommended implantation period for EndoBarrier is being reduced from 12 to 9 months, there may be situations based on the data I've just shown you that removal at 6 months might be considered to reduce the serious adverse event rate even further.
Thank you. Yes, we have time for questions.
Yeah, the question is
Well, in our experience in my clinic, and we published this, 3 years after removal of the EndoBarrier, 77% of them had maintained the improvement. It has to be said that we did keep them under review according to need. Some people we saw every 3 or 4 months, some less often, depending. I would say that on the whole, these people were so happy about what had happened to them, and they really didn't want to go back. And if you support them, you can support them to maintain the improvement. And we found that the 27% that did go back to baseline, nearly all had major things like terrible things that happened in their lives, bereavement, divorce, losing their job, so that they no longer cared, basically. So they just went back and put all the weight.
Thank you. Any other questions? Yes, we can go to the next speaker.